Sleep apnea, specifically obstructive sleep apnea, is a condition where people have disruptive sleeping at nighttime. This can vary in range and spectrum from just mild to moderate snoring to periods where they're actually stop breathing at night, and that's referred to as obstructive sleep apnea. Snoring by itself may not cause any medical issues, but it can be a social nuisance, and there are treatment options that we have here in our office that can help with snoring by itself. But if there's some question of a person having more than just snoring and having actual sleep apnea, then we usually recommend patient obtain a polysomnogram or a sleep study. A sleep study is done at a sleep center where they spend the night, and basically it's like a hotel room setting, and they sleep there, and they'll put monitors on the person while they are sleeping, and they measure their various things such as their heart rate, their oxygen levels, their brain waves, their respiratory rate, and different physiological functions. Based on that, we can figure out where on the scale that they fit, if they have just snoring or mild or moderate or severe obstructive sleep apnea. Now, in terms of treatment for obstructive sleep apnea, usually we try non-surgical methods. This is usually handled by the sleep medicine physician that performed the sleep study. One therapy for obstructive sleep apnea after it's been diagnosed is using what's called a CPAP, which is a positive airway pressure. This is usually treated by the sleep medicine physician who performed the sleep study. A CPAP is basically a type of mask that a person wears who's diagnosed with obstructive sleep apnea. This mask allows increased airflow through the upper airways, so more air and oxygen get to the lungs, thereby treating the obstructive sleep apnea. If apnea is not treated, there can be long-term problems such as increased risk of high blood pressure, increased risk of heart disease, and increased risk of a stroke. So this is definitely a medical problem that needs to be treated. If the CPAP, in some cases, is tolerated very well, in other cases, not tolerated very well. In those patients where CPAP is not tolerated and they're looking for an alternative method for treatment of the apnea, other options would include a dental device to help bring the jaw forward in the hopes of increasing the airway in the oral cavity. Those also have mixed reviews, and some people tolerate them and others do not. If finally all the non-surgical approaches have not succeeded, that's where an ENT surgeon such as I come into play.